My name is Thomas Allen, and I am the Division Manager of the Office 365 Advisory Arm of CyberStreams. CyberStreams is a cloud and Office 365 implementation master. I say that because we've done hundreds of these, and we've done so many that Microsoft is funding this video series to help educate users on some things that are misconceptions about Office 365 in the market. So essentially, this particular video is going to be addressed towards hospital administrators, practitioners, people concerned about whether or not Office 365 would be able to be implemented in a clinic, a hospital, or any sort of a medically compliant HIPAA-regulated environment. So the first major point that is going to be addressed with a medical practice looking to use Office 365 is, are they willing to sign, is Microsoft willing to sign a HIPAA BAA? That is a Business Associates Agreement. Essentially what that means is that Microsoft is signing an agreement that says there is a specific HIPAA-compliant standard pertaining to the way that they will handle your PHI, which is patient health information, as I'm sure you know if you're watching this, and that they will protect that data up to the standards necessary for the industry that you're working in. And so I guess the summary of what I'm saying is, yes, they will sign a HIPAA BAA. So another major point about Office 365 and whether or not your information for your medical institution is going to be safe in their cloud is some compliances that are internationally recognized standards. In fact, ISO here stands for International Standards Organization. These are standards that Office 365 data centers across the world have met basic requirements to have a high level of information security. So let's talk about some of these. ISO 27001 is an internationally recognized standard pertaining to the way that a data center is managed in terms of how it handles the types of devices, the security of those devices, and the actual physical security of the data center itself. So we're talking about things even as high as doing, fingerprinting of everyone before they go in, or hand scanning or retinal scanning. So there's some basic security requirements as to who can get into these data centers and are we compliant with those standards. SSAE 16 and 3402 are US-based standards that are now also used throughout the world. These were previously known as SAS 70 Type 2, which was a major security thing around the US world if you're familiar with regulated industries. Essentially, Office 365 is compliant with both those standards, so you can rest assured that not only are they meeting internationally recognized standards, but they're meeting them in multiple dimensions. Lastly, a major thing for a lot of healthcare providers is my information going to leave the country if I don't want it to? And the simple answer to that is no. If you would like to request that your information is not geographically distributed, you can do so. By default, Office 365 will create what they call geographic redundancy. So that essentially means there's a data center in North America, there's a data center in Europe, and there's a data center in Asia. For most companies, that's actually great because that means the tidal wave can't wipe you out. However, for some companies, they aren't allowed to have the data leave the country that it's interacting with. Patient health information is one of these things. So it's very important for a medical institution to be able to request the exact location that the physical data will reside in. And you can do that with Office 365. You can't do it with other services that are out there that are major hosting providers, but you can do it with Office 365. So the next question that perks up in most people's minds when I tell them what I've told you so far in the video is, well, how secure is the application itself? Forefront is Microsoft's security solution. They have custom developed dozens of different versions of Forefront for their various different products. And for Office 365 specifically, they've actually custom devved several different versions of Forefront so that they can fit security into every single nook and cranny of Office 365. So for your email security, your antivirus, your spam filter, there is a custom developed application, a custom version of Forefront, which addresses just that. And then for your use of SharePoint and any data that resides there, they have a specific security application that addresses that product. For use of Lync, same thing for your use of some of your desktop products and some of your endpoint protection. They're addressing all these needs, and they're able to do it with Office 365. The other major question is, how is my information getting from point A to point B? 128-bit AES, for a lot of people that doesn't mean anything, it's just a bunch of letters on a board. Basically what that is a US adopted standard that was adopted by the US military for how they transfer information. Suffice it to say, it's a type of encryption standard that currently, using modern computer technology, would take almost a century to crack. And so your information is pretty secure when it moves from point A to point B. Obviously, the armor is not perfect, but as far as what's securing your actual use of interacting with content, you're dealing with an extremely robust platform, and in terms of how your data is transmitted from point A to point B, you're pretty much locked up. So it's one of the most secure platforms out there as far as cloud computing goes. In fact, I would argue it is the most secure platform, and you can feel very confident putting your healthcare information on that platform. So if you have any questions about the information that I discussed in this video pertaining to any of the security regulations or specific circumstances that your healthcare practice might fit under, feel free to give us a call. My name once again is Thomas, and you can reach me at 425-274-1121. If you prefer to use email, you can also reach me at thomasa@cyberstreams.com, and I'd love to hear from you.